All right, hello everybody. Welcome to our next topic here in therapy and treatment. Today we're going to be looking at humanistic therapy and treatment. So our objectives and standards are to understand how humanistic therapy and treatment work, and to analyze techniques and strategies used in humanistic therapy and treatment. And take a moment there to read the standards if you would, please. All right. So our desired result today is what strategies and techniques are used in humanistic therapy and treatment to help people. A couple of vocab words here. Humanistic therapy is a focus on the value, dignity, and worth of every person, and believes that healthy living is, a result of realizing one's full potential. Client-centered therapy is a belief that reflects the view that the client and the therapist are partners in therapy together. Non-directive therapy is a free flow of images and ideas with no particular direction. Active listening is an empathetic listening strategy where the listener acknowledges, restates, and clarifies the speaker's thoughts and concerns. And unconditional positive regard is consistent expression by the therapist of acceptance of the patient no matter what the patient says or does. So understanding humanistic therapy, helping people fulfill their human potential is the goal of humanistic therapy. It has given rise to several approaches to psychotherapy known together as client-centered therapy. Now, this type of therapy stresses the actualization of someone's unique potentials through personal responsibility, freedom of choice, and authentic relationships. So the process of client-centered therapy, it's based off of the theories of Carl Rogers, the gentleman right there. This is called client-centered or person-centered therapy, and this is a key element of humanistic therapy. It depends on a person's own motivation towards growth and self-actualization, so, understanding themselves and where they want to grow in their lives. Therapists who use client-centered therapy believe the people can handle their own lives and that they need help in realizing their own strengths and to helping them build their own confidence. One of the ways that humanistic therapy views client-centered therapy to help that in the beginning is by using the term client instead of patient. You'll notice in the last lesson we called them patients. In humanistic therapy, they call them clients. And the reason they call them clients is it makes a person feel more a part of the relationship between the therapist and themselves. Instead of saying, hey, you're my patient and I'm in charge of you as your therapist per se, the therapist will say, hey, we're in this together. We're going to work on this together to make you better. Rogers said this equal relationship has three therapeutic components. The first is positive regard, and this is the ability of the therapist to demonstrate care and respect for the client. Empathy is the ability of the therapist to understand what the client is feeling, saying, hey, I can understand that you're feeling sad, that you lost your family member, or your family member passed away, or I can understand that you're stressed over applying to colleges or whatever the case may be. Genuineness is the ability of the therapist to act towards the client in a real and non-defensive manner. So meaning that the therapist doesn't judge you, okay? They listen to what you have to say. They don't make faces when you say, I did this, this, and this. They don't go, oh, that's wrong. They might say, here's a better alternative, or here's some things to think about, but they don't go, whoa, 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 stop. I don't think that's right. You're making the wrong decision. They're there to be genuine to you, to be honest, and, also just to show they care about you. So non-directive therapy. So non-directive therapy is this. During an interview, a client, or the patient if you'd like to call them that, but in our terms for this lesson we're calling them a client, is encouraged to speak freely about troubling matters. And for the conversation, topics are entirely up to the client. They could be talking about the zoo one day, they could be talking about their job 2 minutes later. So it can go all over the place, but this is non-directive therapy. It's called non-directive therapy because the therapist does not direct it. The therapist does not say, let's talk about your job, let's talk about what's going on at home with your family, how's school going. They kind of just say, hey, what's going on? Why are you here today? What's bothering you? What do you want to talk about? And that's, it's up to the person or the patient or the client to, uh, you know, keep the conversation going that way. The main jobs of the therapist are to listen and to encourage the conversation. So obviously, to keep the conversation kind of going, they might ask a question or two, but again, they're not really directing it in the sense that they're controlling what they want the person to talk about. Active listening. Active listening is when therapists use this communication technique that's known as active listening. It involves the therapist echoing back as clearly as possible the feelings the client has expressed. So let's take this gentleman here who's on the reveal bubble. Okay, let's say he says something about, let's say, school. Okay, he's talking about school, and maybe he's stressed about a test or applying to colleges or whatever the case may be. Maybe he's nervous about it, trying out for a certain sport. So he's talking about school. What the therapist will then do here in the listen section is he will then listen and then repeat back to the person, say, okay, so I heard you say you're concerned about school, you're nervous about applying to college, you got to try out for your sports team. So, am I right in that? And then the person will go, yeah, that's what I'm talking about. So that's active listening. By doing this, it allows the therapist and the client, both of them, to form a clear picture of how the client feels about themselves, their life, and others. And that's why I have this understanding bubble here, because they both then have a clear understanding of what is going on in the conversation. Unconditional positive regard. Emotional support is also important in a client-centered therapy atmosphere, according to Rogers. He calls this unconditional positive regard. Let me underline that there. My apologies. That's one of our vocab words, unconditional positive regard. A therapist never says what he, she thinks of the client, or whether the client is good or bad. Okay, and we said in the beginning, not saying, hey, what you're doing, what's your job, or what you're doing with your family is wrong. Again, they may say, here's some different options, or here's something to think about I'd like you to try, but they don't tell you, what you're doing is, choice A you're doing is wrong, you should do choice B. They might give you A, B, C, and D, but they're not going to tell you which one they think is the right one necessarily. The therapist also shows the client that what they say is accepted and not judged. They want the person to feel comfortable, relaxed, calm, and if the client feels more relaxed and calm, then they're more free to open themselves up and explore themselves and, talk about their experiences and maybe, get a better understanding of why they're stressed or anxious or things like that. Over time, they will begin to abandon their old fears and values to discover new ways of living and new relationships with others. They also begin to feel more complete and to gain courage to accept parts of themselves, whether they be good or bad. When I say relationships there, relationships with friends or family, things like that. All right, so what strategies and techniques are used in the humanistic therapy and treatment to help people? All right, think about active listening, unconditional positive regard, all those types of things. Okay, and please try look at the questions that follow with the 2 videos at the bottom here. If you have any questions about anything, let me know. Have a great rest of your day or night.